Announced that South Africa has administered over 4 million vaccinations to date. The minister has, however, admitted that South Africa has a long way until it reaches population immunity. Now, with the COVID-19 third wave gripping the country, health experts are warning of more waves with the current slow pace of vaccination rollout program. For more on this, I'm now joined by Professor Tumbi Ndungu, the Deputy Director at the Africa Health Research Institute, and Dr. Michelle Groom, who is Head of Public Health Division of the National Institute for Communicable Diseases. A very good afternoon to you both. Now, looking at statistics from the last 24 hours, 22,910 new cases recorded, with Gauteng accounting for the majority of this. Dr. Groom, should the current lockdown restrictions carry on?
I think we really need to have a look at what restrictions are in place and what we really need them to be doing. And I think at the moment, especially for Gauteng, there's already widespread transmission actually in all the provinces. And so restrictions like the restrictions of movement may not necessarily have any impact now because we're already starting to see increases in the other provinces. I think what we really need to be able to do is to have available beds for hospitalizations. And I think that, the cases look like they've started to plateau in Gauteng, but I think we really need to make sure that we're not filling up the beds, available beds with trauma cases. And so I think the burden of hospitalizations is still going to be, very high in the coming weeks, especially in Gauteng. But I think the other provinces are following suit. We've had, big increases in Limpopo and Mpumalanga, Western Cape, and I think that we really need to mitigate in terms of making hospital beds available.
So, Dr. Groom, are you saying that movement or gatherings are not the cause of transmissions from what you've observed?
No, not gatherings definitely are. So I'm saying more the movement. So I think if we wanted to try and, obviously we had high, incidents in Gauteng, and we didn't want, that particularly, moving into other provinces, but we are starting to see that now. But definitely, no, the gatherings are. So I think a big thing is really to limit gatherings to actually within your families, if at all possible. And so I think limiting interaction between people, more so than kind of movement between provinces. So just to clarify that. So we really want to be able to limit people's interaction because that's how the virus is spread.
Professor Ndungu, we are currently experiencing this third wave. Dr. Groom has talked about a plateau. How long do we expect it to last?
Thank you very much for having me on the show, and thanks to the viewers as well. I think it's very difficult actually to predict because the longevity of the wave and how long it lasts will really depend on how people respond to some of the measures that the government has put in place. And so as to the extent that we are not able to completely predict how long that people are going to behave in different provinces, it's really difficult to predict that. But I think going by historical data, we have seen these waves last for about 3 weeks to about a month before you start to see cases coming down. So one would expect that would be the case here. But like I said, I think that these waves can be modified in terms of how high they go, as well as how long they last by how people behave. And so the more we get adherence, people adhering to these lockdown regulations, I think the better we will be in terms of shortening the length of the wave.
Now, the numbers that we continue to see, as I said, a little over almost 23,000 in the last 24 hours is frightening. What are people not doing, rather, I think is the question. Certainly to curtail these numbers.
I think that maybe lockdowns came in a little bit late. And I think you can understand the reluctance of the government, of course, to impose more and more restrictive regulations in terms of restricting movement and in terms of restricting economic activity, because I think you have to weigh between the livelihood that people need. When you have these restrictions, you curtail, a lot of economic activity, which I think a lot of citizens are getting, beginning to get very tired of. So I think that it is a very fine balance here between saving lives as well as imposing these restrictions. So I think that the restrictions may have, come in late. I know that there's a lot of pressure from the government from different sectors. In my view, some of these restrictions, such as restricting the sale of alcohol and are very reasonable, because we know that when people congregate and as well as when people use alcohol, inhibitions tend to be less and people tend to interact more in close spaces. So I think that some of these measures, for example, restricting alcohol use, could have come in a little bit earlier. But I do completely understand the reluctance to actually do that, because of the fact that even the alcohol industry has been against some of those measures. But I do think that it is the right way to go in terms of trying to blunt the peak of this wave.
Dr. Groom, let's come back a little bit to capacity that we have in South Africa, in Gauteng, to certainly house or take any issues or individuals that have the virus. A lot of people are succumbing, are walking into hospitals, and there is insufficient capacity. We do know that there were a number of field hospitals that were paid for at the start of COVID-19. What is the status on the ground?
Yeah, so I think this, is determined by the Department of Health. I really can't speak to their kind of opening the field hospitals and that. But I think really at this stage, I think this wave is probably bigger than we thought. I mean, obviously there was modeling and there were some predictions but we've surpassed even those. And I think the wild card in all of this was always the emergence of a new variant or transmission of a new variant. And so really, especially, in provinces like Gauteng, we've seen it far surpass. It's more than double what we were seeing with the other waves. And so I think we really do need to, capacity, even if, so the cases in Gauteng seem to be plateauing, but I mean, other provinces are still increasing. But we know that there's this lag between cases and hospitalizations. And so we would still be expecting the next 3 to 4 weeks still to be, putting a lot of pressure on the hospitals. And I think that's where these restrictions, such as the curfew, which, limits people, moving around late into the night, and the alcohol, as my colleague had said, can decrease the number of trauma admissions, from car accidents and other traumatic injuries, so that we can, increase that capacity. But I think all the provinces have resurgence plans and are working. There have been a lot of additional beds which have been added to the existing capacity, and obviously trying to, I know many of the hospitals have now stopped, non-urgent surgical procedures, and so there is that capacity to now use that for COVID hospitalizations.
Now, it's been announced that on the 15th of July, those that are 35 to 49 years of age will be able to be vaccinated. Is a vaccination rollout program going at a fair rate, or is it all too slow, do you think?
Yeah, well, I think it's really unfortunate that we didn't get our program, up and running a lot sooner, that we could have had more people vaccinated before this wave. And I think the problem now is trying to, manage the COVID infections and as well as the vaccination plans. And I think that does limit the amount. We don't want vaccine centers to be super spreader events with congregation of lots of people. We don't want to be, putting people at risk there. There's, resources which may otherwise have been used for vaccination that may now have to be used in terms of treatment of COVID. So I think, we need to, scale up our vaccination, and I think it's difficult in the present circumstances. But I think, as soon as possible, we need to start vaccinating, as many people. And I think our vaccination rates have definitely increased. And I think we had the most vaccinated, towards the end of this week.
Now, Professor, the Lambda variant has been detected in over 30 countries. And its greatest impact is obviously in Peru and South American countries. Now, how do we safeguard ourselves against these variants, which we know nothing about until pretty much they've hit our shores?
Actually, I don't think there is much that we can do other than increasing the rate of vaccination. Part of the reason that these variants, of course, emerge is because there's continued transmission of the virus within the communities. And then as long as we have sizable levels of transmission within communities, you're going to see new variants emerging. Remember, this is a new virus that has entered the human population recently, and it is trying to adapt to the human population so that it can transmit itself better. And so as long as we don't have enough people vaccinated within the community and you have transmission happening, you're going to see new variants emerging. And I would predict that Delta will not be the last, and even Lambda will not be the last one of these. So I think what we need to do is to ramp up vaccination. Vaccination is the best public health strategy we have against infectious diseases. It is what is going to cause the emergence of new variants to disappear so that we don't have to deal with the new variants emerging. And luckily, all the vaccines that we have at the moment seem to be very effective against most of these variants, at least in terms of preventing serious disease and death. So I think we need to very rapidly, as my colleague has mentioned, to ramp up vaccination, make sure that this program succeeds. And the more that we get our populations vaccinated, the more we'll ensure that we don't have to deal with the variants emerging.
Dr. Groom, the recovery rate continues to fall. What are the contributory factors to this?
Well, I think the recovery rate is kind of, it's a factor of how many new cases are coming in as well as how many are, because we've got this lag of between new cases and hospitalizations and deaths. I think if there's a steep on the upward slope, you're always going to, have more and more new infections where the recoveries will lag. So I think it's not, that the people aren't recovering. I think it's just the way that is calculated in terms of if you're on a steep slope up, lots more, people are being infected in a very short time, and then recovery might lag behind that.
Now, when you look at what's happening globally, certainly in certain parts of Europe, everybody's able to go to football matches again because in many instances, the majority of the population has achieved a herd immunity. Now, we've only vaccinated 2.1% of the population. What is that landscape looking like for you both, starting with you, Professor?
I think this underscores the inequities that we have in the global public health system, where the rich countries obviously were able to procure vaccines. They are resource rich. The vaccines are being made in these countries, and they to their credit, invested in research and development, so they were able to very rapidly move to deploy these technologies against this new virus. So what we need in the immediate future, in my view, is to make vaccines available for poor countries immediately, through global programs of vaccine access and making resources available to ensure distribution, because that's also the logistical distribution of these vaccines is also not an easy task. But in the long run, for us in developing countries such as South Africa, what we need to do is to begin to invest in our research and development, so that if we have to face this kind of pandemic in the future, we have invested in the manufacturing and in the development of these vaccines, and we can rapidly deploy the technologies that are needed to make vaccines, and we don't have to depend on others. We don't have that at the moment, so at the moment we have to depend on these global initiatives to rapidly distribute the vaccines. Remember that as long as our countries are not safe, even African countries and other resource-limited countries are not safe, nobody really is completely safe, because you can have new variants emerging that will begin to impact even the vaccines that we have, and who knows, these vaccines could spread to, these variants could spread to other countries.
And your thoughts, Dr. Groom, on the same question? Yeah, so I think definitely, I think it's the inequalities, and as my colleague said, we won't be able to control this pandemic without a global success of the vaccination program. And I think it's also, in terms of a positive, look in terms of people who are skeptical of vaccination. If we do look at countries, like the UK, where they have also had detection of the Delta variant, they have had some increases in cases, but there hasn't been an increase in hospitalizations and deaths. And I think that's really important for us, for people who are are hesitant to be vaccinated. That it's a severe disease that we're curtailing, and we can look at these countries and really see, it may not, you may still be able to, you may still have mild infection, but the hospitalization rates, the deaths are decreasing. And I think, that's really what is useful for our country, just to be able to encourage people to vaccinate, and that the only way we're going to get back to normality is really through a vaccination program.
Now, Dr. Groom, the National Coronavirus Command Council meets tomorrow. What would you like to see coming out of that meeting?
Yeah, very difficult to say. I think, as my colleague said, we really do have to weigh up, lives versus livelihood. And I think there does need to be a balance in that, in terms of what we would like to see. Obviously, at this stage, the wave has been much worse than we thought, with circulation of this variant. And I think there definitely have to be some measures in place to try and, decrease transmission. At the end of the day, regardless of what, is restrictions are imposed on us, it really is up to every individual. If every individual, made a concerted effort, to remain at home, to only go out if needs be, to not socialize, even with family members, I think we could really make a big impact, regardless of what's been imposed of us in terms of the government. And, it is really up to our individuals to not just be looking out for yourselves, but to be looking out for others.
Dr. Groom, you talk about certain measures being put in place. What would these measures be?
Yeah, I think you're putting me on the block. I think definitely things like the curfew. I think we would want to be able to limit, movement, after hours. We would want to be able to, at least people still be able to work as much as possible. I think it's very difficult in terms of for example, the restaurants industries, which, are really being impacted by the current restrictions. But then on the flip side, the alcohol question is very difficult, because, we've seen studies and we've seen that it does decrease the admissions for trauma, and yet, the livelihoods of people in these industries are also being affected. So I think it's a very difficult decision to weigh up, the two sides and to get the proper balance.
Professor Ndungu, before we let you go, your thoughts on that NCCC meeting tomorrow. What would you like to see coming out of that meeting?
I would like to see us move maybe to an adjusted level 3. And by that I mean perhaps continue to limit some of the movement and congregation of people in large numbers. I think that is a reasonable measure to put in place. Perhaps relax some of the restrictions on things like the restaurant industry, but perhaps continue to limit alcohol sales in these establishments, as well as even in other establishments that sell alcohol, because I still feel that that's a major driver in terms of when people congregate. So without being private to all the data that the Command Council has, because I'm not private to whatever data they have. But that's what I would suggest, is that we need to move to level 3 to allow some economic activity to go on, but to do it in a smart way, so that we are still restricting large congregations of people and any kind of incidences that could lead to people coming together, such as alcohol sale, particularly in establishments such as taverns and other places where people congregate.
Appreciate your time, the both of you. That was Professor Thumbi Ndungu of the Africa Health Research Institute and Dr. Michelle Groom, who is with the NICD. Seem to be mixed feelings on how to deal with the possible outcome of NCCC meeting tomorrow. Now, still to come.